During one of my, let's say, early visits to the archives of the International Atomic Energy Agency, I came across an amazing picture. I thought it's an amazing picture at the moment. A dummy in a suitcase caught my immediate attention. I hadn't seen something like this before. It was modeled on the human female torso with prominent breasts and a thin body, but without hands, without clothes, so only the upper part. It reminded me actually of the mannequins that appeared in shop windows throughout the 1950s and 60s in the United States. It was the time that consumerism was booming, and the mannequins embodied what was considered in the modern culture the ideal of female beauty: tiny waistlines, high busts, and sloping shoulders.
During the 1950s and 60s, one of the most valuable diagnostic uses of radioactive isotopes was measuring how much radioactive iodine 131, the thyroid gland, absorbed in patients with thyroid disorders. The thyroid, a small gland in the neck, plays a crucial role in producing hormones responsible for the body's growth and development. It also helps regulate many vital functions by steadily releasing thyroid hormones into the bloodstream. When the thyroid doesn't function properly, it can lead to two main conditions: hyperthyroidism, where the gland becomes overactive and produces too much hormone, or hypothyroidism, where it becomes underactive. Radioiodine plays a crucial role in thyroid diagnostics and treatment because it naturally concentrates in the thyroid gland. This unique characteristic made the radioiodine uptake test a widely used tool for diagnosing thyroid diseases and treating thyroid cancers. The procedure was simple. Patients took a dose of radioiodine by mouth, and 24 hours later, scientists measured how much the thyroid had absorbed. These results helped determine the specific type of thyroid disorder affecting the patient. However, the results of the uptake measurements weren't always straightforward. Concerns grew as differences in methods and equipment used in laboratories around the world led to low reproducibility and repeatability in measuring exposure. The deviation of the measured value from the true value was often depressingly large. Even in many European countries, one could certainly not consider underdeveloped with regard to nuclear medicine, said the head of the IAEA's section of medicine, Herbert Vetter. Moreover, beyond its medical uses, radioiodine was one of the radioactive materials that posed significant health risks to an estimated 10 to 75,000 Americans. This was due to what is known as fallout from open-air atomic bomb testing conducted by the US government in the 1950s.
This put the United States in great unease on an international level. At that moment, the Atomic Energy Commission of the country was facing the results of nuclear tests in the Pacific. To address local concerns, but also to collect radiation data, American teams of medical doctors and health physicists were monitoring the inhabitants of the Marshall Islands. They were checking on their health and especially the function of the thyroid glands, given that most of them were exposed to radioactive fallout. At that moment, the subtle shift of responsibility for measuring the effects of fallout to an international regulatory institution such as the IAEA seemed ideal.
On September 24, 1959, Admiral Paul Foster, the US representative to the IAEA's Board of Governors, addressed Sterling Cole, the agency's Director General, with a proposal. The United States believes that the agency should consider sponsoring a program in its calibration and standardization activities, he wrote, referring to the thyroid uptake measurements with radioiodine. In mid-December, Cole responded rather affirmatively, promising to write a circular letter to all member states informing them about the project. By January 25, 1960, Herbert Vetter wrote to Foster that we've started to make preparations for a so-called thyroid phantom project. Godofredo Gomez Crespo was nominated by Deputy Director General Henry Seligman. A Spanish physician and graduate of the University of Salamanca, Gomez Crespo moved to the United States in 1955 to work as a radiologist at Western Reserve University in Ohio. A polyglot, he was fluent in Spanish, French, English, Italian, and Portuguese. After a swift hiring process, the first task was to organize an experts meeting at the end of November 1960 to thoroughly discuss the technical details of the calibration and standardization procedure. One of the major issues was the construction of the Phantom. As reported in the consultants' meeting in 1962, which included a panel of experts, all men from Western countries, this Phantom should be a cylinder of 15 centimeters diameter and of 15 centimeters in height, made preferably of lucite or perspex. It should have a hole which would accept the standard vessel. The distance from the edge of the Phantom to the surface of the hole should be 0.5 centimeters. The IAEA hired an artist and a nude model posed for the construction of the mold.
So the question is, how did a strictly technical description of a phantom, which precisely defined only sizes and materials, get translated into Francoise with her perky breasts, a female mannequin? How did this happen?
Transforming a fact into an artifact is a key aspect of what Bruno Latour described as science in action, the process through which scientific facts are created through the collective actions of scientists.
This is the time that my focus shifts to the material culture of Oak Ridge and the history of its female mannequins.
Going back to 1956, Marshall Brucer, a physician and pioneer in nuclear medicine, with the collaboration of different scientists at Oak Ridge Institute of Nuclear Studies, led the efforts to standardize the radioiodine uptake measurements. The idea was to fill a shop-like mannequin with a mixture of mock radioiodine to work as a standard. Having determined the mixture of mock radioiodine, Brucer and his team in Oak Ridge designed their first dummy, Abigail. By 1956, 8 Phantoms were ready and being used for calibration purposes. With strong support from the Atomic Energy Commission, the second phase of the Oak Ridge Research Project in 1956 focused on calibrating equipment both across the United States and in England. By the time Foster addressed Cole in September 1959, Oak Ridge had just published its final report on the project, Orange 19. As Foster explained, the United States anticipated receiving requests from foreign countries to borrow its calibration kits and Phantoms. However, since the IAEA already included calibration and standardization activities in its program, what could be better than adopting the technique and offering a similar service worldwide? The AEC generously proposed to provide an expert on the technique. In his response, Cole agreed to develop the program along the lines of the Orange Report. The Orange 14 report was prefaced by a picture of 6 female dummies. Each of them was placed in a suitcase like the one hosting Francoise. What is striking is that each was different from the others with respect to facial characteristics and their wig. All were white young females with wigs of different hairstyles and colors, featuring a bold painted lip. Another picture that never made it into any of Brucer's reports featured the same perspective of the 6 dummies and included Brucer sitting in front of the mannequins, smiling, full of confidence.
Ironically, Bruce's photos surrounded by his phantoms, all these female creatures, immediately reminded me of Hugh Hefner, the guy that founded the Playboy in 1953, and his usual photo shoots with him surrounded by all these beautiful women that were equally standardized playmates. I think that there is a very strong connection between the two images. Both of them were taken during a period in the US history when women were strongly objectified.
Although Francoise is proven to be a continuation of Bruce's chorus of mannequins, her design was somewhat toned down a bit compared to an earlier design that was transferred to the IAEA in Europe. Eventually, the recommendations of the IAEA panel experts were heavily based on Bruce's experimental settings, including the description of the phantom. As Vetter explained to Warren Sinclair, a prominent member of the International Commission on Radiological Protection, ICRP, in practice, this could be a continuation and expansion of Marshall Bruce's Mannequins project. Francoise needed to be easily transportable and adaptable to both advanced and developing countries. The overall aim was to establish a relatively simple but reasonably accurate standard method which could be used even under rather primitive conditions. Thus, in 1961, the IAEA team constructed only one mannequin, Francoise. Over the course of 3 years, between 1962 and 1965, Gomez Crespo traveled the world together with Francoise to test and calibrate the local equipment of a network of 199 laboratories in 41 IAEA member states. Unsurprisingly, the IAEA's radio ion uptake measurement setup became a global standard. In the agency's photographic archive, one can find photos of measurements performed on patients in countries all over the world, from indigenous Indian peasants to a mountain village of the Chilean Andes, to Iraqi schoolchildren in the densely populated city of Baghdad.
My point here is that things, and especially experimental things, have stories to tell. They preserve historical events that might initially seem unrelated. As one looks into the social, let's say, and cultural histories, they also make connections materially present. Keep in mind that the first Barbie doll, a kind of miniature mannequin, was launched around the same time by the American toy company Mattel. That was in 1959, and it sold 3 pieces per second the very first year. During the same time, Orients and the IAEA were fashioning calibration phantoms that resembled Barbie. Abigail, for example, in the entire line of Bruce's dummies mimicked white, petite American women, such as Hefner's, for example, playmates, that acted as agents of facts and universal standards in medical physics in locations where they were definitely not the norm.
And in the case of Bruce's mannequins, the story is even more fascinating. Undoubtedly, he was a pioneer in medical physics. The AEC recognized his outstanding achievements by awarding him a gold medal in 1965, and during his Oak Ridge years, he received several awards and prizes for his exceptional clinical research in radiation. But he was also a controversial figure, known for his personal charms. As Sinclair explained to Vetter, Bruce's somewhat jocular way of setting about scientific matters does not meet with approval in all quarters. In one of his interviews, musing on the fact that the majority of his colleagues insisted on alerting the public about the effect of radiation, he noted, "I am not against health physicists. I just think that 75% of them ought to get shot." And yet, his masculine, provocative character never got in the way of his professional recognition. It was men in nuclear and medical laboratories who had complete control over Francoise, or Abigail, or each of Bruce's other girls. They were their products. The intimate connection between objects and power is manifest in the fact that technical specifications of things were translated into imaginary, sexualized female figures, which in turn became canonical experimental devices offered in the nuclear market as commodities.